I'd like to welcome everybody here today. We're going to be doing an information lesson on how to use an AED. So is everyone here familiar with AEDs?
Sort of.
Okay. Have you seen them around town? When you go places, have you looked and seen them? Yeah. Does anyone have one in their workplace?
Yep.
Do you have one here? Oh, you don't think so? Have you ever had to use one? No? Okay. So AED stands for Automated External Defibrillation. And what an AED is programmed to do is apply an electric shock to a heart that has stopped beating normally. What the AED does is two different things. It analyzes the heart's rhythm, and then it administers a shock depending on that rhythm. So let's go over how it operates. So first it's going to analyze the heart's rhythm, then it's going to decide if it's a shockable or non-shockable rhythm. A non-shockable rhythm would be if the heart is beating normally or if the heart is not beating at all. So if you have a normal heart or you have no beating, it's not going to shock you. A shockable rhythm would be if the heart is beating abnormally or too fast. So basically what it's going to do is it's going to take that heart that's beating abnormally or too fast and it's going to reboot it. So it's going to stop that rhythm and in hopes that when it starts back again, it starts in a normal rhythm again. Then the AED will tell you to begin CPR. You're going to perform 2 minutes of CPR. After that, the process is going to start all over again. And it will analyze the heart's rhythm, decide if it's shockable or non-shockable, then it will tell you to start performing CPR. The nice thing about the AED is it's always talking to you and telling you what to do. So all you have to do is listen and follow the instructions. Most AEDs will have a ticking sound for you to keep time to when you're performing the CPR. 2 minutes of CPR is doing your 30 breaths and 2 ventilations 5 times. But don't worry too much about that because the AED machine will actually take all that into consideration for you. Now, something also to be aware of is some AED machines have a recorder built into them. This is kind of important because it will record everything it hears, everything you say. You're going to find those mostly in jails, the pen, maybe even the nursing homes will have ones that are recorders. So that's something to be aware of, that if you're doing something on somebody, don't say anything you don't want heard back. When to stop using the AED is when EMS takes over the care of the casualty. Now make sure you always leave those pads attached to the casualty because EMS will just attach their machine to those pads. The pads are just a one-time use. So the person who's in charge of that AED machine that is being used will have to make sure they replace those pads in there. If the casualty regains consciousness, don't detach the pads either. Remember, it's always analyzing the heart's rhythm, so it's not going to shock again unless it needs to. So leave everything hooked up in case you need to use it again. So now, do you think you can use an AED on children and infants? Think so? Yes. They make children pads, and they look like this. All AED pads will have pictures on them to show you where to put them. So on a child, you're going to put one in the front and one in the back. So that's how it's going to shock the child. For an adult, pads, they have pictures as well. You're going to put one here, and you're going to put the other one here. Okay? And it goes across the body, and it shocks the heart. Okay? If you don't have child pads, do you think that you can use the adult ones? Yes. If you don't have child pads, you can still use the adult ones. Just make sure that you remember one in front and one in back. Don't follow the pictures for the adult ones. They will only shock, it's a smart machine. It won't shock more than it needs to. It analyzes and it knows the body size of the person. What about if somebody's pregnant? Do you think we can use it?
Say yes.
The shock is just passing through the heart, so there's no harm to that baby. What about in a moving vehicle? Do you think we can use an AED machine in a moving vehicle?
I think so.
No.
No. Sorry.
You can't use it in a moving vehicle because it won't analyze properly because of the movement. The same goes if somebody is touching your casualty when you're using an AED. If somebody else is touching it whose heart is beating normally, it might not register the person who's not beating normally. So you want to make sure before you use it that nobody is touching that casualty. So no moving vehicle and no touching. What if somebody has a pacemaker? Some people have pacemakers that are built right in, right?
I would say no.
Yes, you can. You can.
Okay.
The only thing you have to make sure you do is keep the pad 2 inches away from the pacemaker. Okay? And what about patch medication? Some people have heart conditions and have nitroglycerin patches. Do you think we can use this on somebody that has one of them?
I would say yes.
Yes. The thing you have to do with that is you have to be careful you don't touch that medicine. So you want to make sure you have your gloves on, peel the patch off, and then take the cloth, there will be a cloth in your bag, wipe all the medicine off before attaching your pads. Okay? So now let's go down to the floor and we will try using our AED. So the first thing you want to do before you do anything in first aid is always put on a pair of rubber gloves, because the first person you want to protect always is who?
Yourself.
Yourself. Okay. Every AED kit will have rubber gloves in them. They will also have razors and scissors. They'll have lots of stuff in there for you to use. So you unzip your AED. Now when you go to pull it out, you're always going to put it at the head of your casualty, because when you go to press that shock button to administer the shock, you want to make sure nobody is touching your casualty. So you're going to want to make sure you look down your casualty, make sure that there's nobody touching. And it's going to tell you don't touch the patient. You also should go don't touch, clear, don't touch, okay? Just to make sure everybody is aware. They might not have heard this because this is a scary situation, right? Okay, so the first thing we do, we pull it out, is we turn it on, and we just follow the prompts.
Remove clothing from the patient's chest.
So removing the clothing, we're going to take those
Open
scissors,
analyzing heart
we're
rhythm.
going to
Bare skin.
shirt off.
touch the patient. Apply pad as shown in the picture.
Now look at your pictures,
Analyzing heart rhythm.
and
Open
apply your
Apply
pads.
pad on the patient's bare skin.
Charging.
One goes on the top, and
Stay
the other
clear
one goes
of
on the
patient.
side.
Shock
Analyzing
device.
heart apply pad
Liver
as
shock.
shown in the
Charging
picture.
the orange
Do not
button.
touch the patient. Analyze
Clear.
pad as shown in the picture.
Okay.
Liver
Do
shock
not
now.
press the pad firmly on the skin.
Press them firmly on there so that they're stuck good.
Do not touch the patient.
Now, when it
Analyzing
says
heart rhythm.
do not touch, remember, go clear, do not touch the patient.
Analyzing heart rhythm. Shock advised.
Okay, shock advised, look
Do
down
not touch the
your
patient.
casualty.
Press the
Okay,
shock
and
or
then
flashing shock
you're
button.
gonna have a light that flashes.
Press the shock analyzing heart rhythm. Begin CPR.
And now you're gonna
Do
begin
not touch the
CPR.
patient.
You can tell
Analyzing
me
heart
how
rhythm.
many compressions
Shock
you would do
advised.
and how many breaths you would
Do
do.
not touch the patient.
30 compressions, 2 breaths.
Right, yeah. And the nice thing about this, you hear that
20.
ticking sound? So it's going to help you with doing your compressions. That
30.
is your
Give
rhythm.
2 breaths.
And this one in particular will tell you to give the 2 breaths. If you don't have an AED machine that gives you a timing for that, you can think of a song that's Staying Alive and sing that in your head as you're doing it. That will give you the proper rhythm as well. Just might not want to sing that song as you're doing it. It might not be a good idea.
Give 2 breaths.
Okay, so everybody turn it off. And we can put it away. Does anybody have any questions about using the AED?
So how would you remove the shirt from your?
The shirt, well, in your AED package, there will be a little bag with some scissors, and you're just going to take and you're just going to cut that whole shirt right off and open it up, because you need to make sure you can see their bare chest, in case there's any patch medication, or you're going to look for that pacemaker, maybe if you have one. So yeah, just cut it right off.
What if the casualty has a really hairy chest?
If it's a man and they have real hairy chest, hopefully it's a man.
Never know.
There will be a little bag in there with the scissors. There'll be a razor, and you're just gonna shave. You're just gonna shave the chest, and then you can apply those pads, because those pads won't stick on a hairy chest.
I do have another question. So do you change the airway, like do you adjust the head or anything like that before you're gonna do it?
The AED machine?
No, the person that's laying there. Do you change their, like sometimes their head would be crooked or something like that? Like
Only if you're going to perform CPR. When
Yeah.
you go to perform CPR, yeah, then you're going to
yeah.
do the head
But
tilt.
before that, like before you do any of that, would you do
No.
anything, adjust?
It depends also on their injury, right?
Right.
Because if there's a head or spinal injury, then you don't want to touch them. Then you're probably going to have somebody holding their head. Okay. Well, if there's no other questions, we'll go back up to the table. And we'll go through a little exam. Okay, so it's just a true or false exam, and we'll just do it together. So number one, an AED can shock all types of heart rhythms.
True.
True. False. False. All right. Remember, if you have a normal beating heart, it's not going to shock, right? An AED can be used on children and infants.
True.
True. Never use an AED on a pregnant casualty. False. False. Never use an AED on a trauma casualty. False. AEDs can be used on casualties with pacemakers.
True.
True. Leave patch medication on the casualty when applying the AED. False. False. You can use an AED in a moving vehicle. False. False. You can use adult pads on children and infants.
True.
True. You should start using an AED immediately. Yes. True. The first thing you do is turn the AED on. True. True. Good job. Excellent. So now your other page is just a training evaluation. I'll get you to fill that out. And when you're done, I'll hand out your certificates. Thank you very much for coming.
Thank you
Thank
very
you.
much.